boss, Stephen Fielding were having about how to meet the needs of the growing aging population and preparing themselves for the future. I myself, for many years, would go out and explain the PACE program, and PACE stands for Program of All-Inclusive Care for the Elderly. While people were very interested in the program, they were often very concerned about how do I get to that financial point where I would be eligible for that in my aging years. So this was a way to provide a community service to the community and giving them answers to those questions. Ellen has many years in the finance area, specializing in preparing yourself for the future, especially in our older years. So it is my great pleasure to introduce to you Ellen Feinsand from this evening.
Thank you very much. It's a pleasure to be in Revere. Planning for yourself and your parents is something that is important, and it requires you to learn new things, to make decisions that are different than you've had to make before, and to take action. Sometimes it's actions that you're prepared for, sometimes it's not. So, a phrase I use, and I say it all the time, it's never too early to start planning for the future, but it often gets to be too late. So I applaud you for coming here tonight because you are taking the first step toward being more prepared than you were before you came. And at the end, I will take questions. And if you have a question in between, because there's something I say that you don't understand and you want to ask it, feel free. Just raise your hand and I'll call on you. Okay? Very good. So, living in retirement. How many of you are retired? Okay, great. Most of you, but some of us aren't. How many of you are not retired? That's right. Yay! Okay. So, when you are retired, once you stop working, as you all who are already retired know, your routines and your activities change. You need to figure out how you're going to spend your time, what do you want to do, and who might you be spending some of your time with. Some of the issues and some of the things you need to do to make a successful event out of living in retirement is it can be very exciting, but you need to prepare for living what we call your best life. The things you can do, that you want to do, and that you might not have had time to do before. But it's best to prepare for your later years, knowing that even if you make some plans, you may need to be flexible because those plans may have to change. You have to think about and maybe prepare for situations before they occur. Nobody plans to break their hip, but lots of people do. So you have to know that could happen. And you also need to take a look at your finances to understand your choices, because with everything else, there are some options that are available if you take advantage of all the benefits you can, and there are some options that you need to learn about to make sure you're getting the most that you can. So, living in retirement is a good thing. However, there are some concerns. Now, here are some common concerns. Where to live, when to start taking Social Security and benefits, when are you eligible for them and when should you take them, how to apply for Medicare, am I eligible for Medicaid? These are all common concerns. Do any of you see concerns in this list that you might have had yourself? The last one. How can I avoid being a burden to my family? That's one everybody either has or will think about at some time in their life. So have you once you had these concerns, did you feel prepared to deal with them? Or was it hard? It's okay if it was hard. Was it hard? Some of it. Yes. That's being honest. We have lots of honest people here in Revere. I'm really happy to hear that. Because sometimes people won't admit it, but it's the truth. So these are not the only concerns, but these are common ones. We're going to talk about how to make sure we can handle some of these. Yes?
The last one, it didn't happen yet.
Right. That's lucky. That's great. So you have a chance to be prepared
Right.
to not be a burden to your family. That's great.
And how do I do that?
Well, let's see if I answer it before the end of the time. Okay? I may not, but you make sure I ask it again. Okay. So there are some topics that you really need to know about in order to not be a burden and in order to take care of some of these other issues. The areas that we're going to talk about these are unique to aging. There are some issues here that happen even when you're not so old and not aging fast. But things like healthcare, everybody has to worry a bit about healthcare. But when you are aging and retired, healthcare gets to be a bigger deal, as most of you may know people where that's the case, or it may be happening in your own home. Healthcare, housing, benefits, finances, and legal issues. These are topics you need to know some stuff about. And I bet you do know some about it, but we're going to cover some of them in a little more detail than you may already be aware of. So, healthcare services. There's a wide range of healthcare services that some of you may know about, and some of you may know people who are taking advantage of. Home care, this is people who come into the home and take care of certain things. Personal care, housekeeping, and custodial care, somebody who needs help making sure they are safe in their own space in case their health is a little on the verge. Adult daycare programs are very popular because this allows caregivers to get a break, and this allows aging people who need some special care to be with peers and to get services in a central location, and they get transportation to and from. So these are very popular programs, and if it's appropriate for somebody in your world, it might be something to do some research on. The services range from those kinds of care, in-home, out-of-home, all the way through to skilled nursing, which is when somebody has real medical needs, might be leaving the hospital, might have a condition that needs help all the time, like perhaps diabetes or other chronic conditions. And then, of course, some of these services are provided in the home, some are outside the home. One area of services that some people don't feel too comfortable hearing about, but it's practical and it's real. Hospice services. Hospice services are for people who are near the end of their life and are available in home, at home, or in a different external setting. When you need it, you should do it, and you should investigate it. And if you know somebody who needs that, you should encourage them to pay attention and their caregivers to consider that. So that's sort of the range of healthcare services, from just a little housekeeping at home all the way through to big medical needs in a skilled nursing environment or hospice when somebody is at the end of their life. Health insurance comes in a lot of varieties, and health insurance helps take care and pay for some of those services that we just talked about and the different levels of services that people need. The common term that we think is called health insurance, but health insurance really covers a big basket of types of insurance. The biggest one is medical coverage. So if you're sick, it's medical coverage. Hospitals, doctors, equipment like wheelchairs and walkers and all of that. Drugs and catastrophic care. there are many types of plans you can choose among for these different types of coverage. And I encourage you to think about your needs in a realistic way to determine what kinds of coverage and protection you need so that you are taken care of by your insurance. The main categories are these mentioned: medical, supplemental for extra things, prescription drugs, which everybody needs, and catastrophic care in case something positively terrible happens and somebody has to be cared for forever, even if they're not old. So these are the types of insurance. There are different programs, there are different offerings, and it takes some skill to make sure you get the right information, which we'll talk about how to do that in a few minutes. The cost associated with health care is very varied. It covers a wide array of things. Insurance, you have to pay premiums, you might have to pay co-payments, you might have to pay deductibles, lots of different insurance costs. There are public programs like Medicare, there are private programs like PACE and like other companies, and there are deductibles and co-insurance, all the different prices. I'm not listing the prices here because it really depends on what plans you pick. But some of these costs, these types of costs, are covered by government programs. Some of them are covered by private, perhaps employer plans and retiree plans. Some people may have that. But residential care is an example of something that may be paid for by Medicaid, but it may not. In which case, for residential care, you may have to pay all or part of it yourself. Some people may have heard of assisted living. That's a type of care, communal environment, where services are available, but people aren't really that sick. People just want to be around other contemporaries and peers and have social and some help if they need it. That is an example of residential care that is not typically covered by any public insurance and is typically paid for out of pocket by the residents. So that's one that is useful for certain people, but the costs of insurance, prescription drugs, and home health care are, to some measure or other, covered by public insurance and policies, coverages, benefits, and private. But residential care, with the exception of some, is usually covered by the person to some degree. So that's an important thing to understand when you think about what your health is and how much you might need to put aside to be prepared for it. Now, we said residential care. Residential care can take place in many places, but there's no place like home. How many of you are hoping to what's called, the term is age in place? How many of you would like to stay in your own home, even if you have to get health care delivered? Almost everybody. That's right. Well, that's good, because it means you want to be proactive and you want to be home and you want to be able to be independent, and nothing could be better than that.
What happens when you want company?
Excuse me?
What happens when you want company?
That's right. Now, that's one issue. When you want company, it's a little harder. That's right. So one thing people who are aging in place do for company is they get involved in a senior center, and they come to places like this to be active and to be sociable and to do activities. And one tiny story that I don't always like to tell, but my mother is 98 and 5 days a week goes to a senior center and has been for more than 25 years. So they're really good. And this one looks like it's really great because you have Revere Senior Power. I think that's like a great, I love that. The one my mother goes to, there's no senior power, just a lot of noise. There's lots of noise. Anyhow, so aging in place is keeping healthy and doing what you want to do, remaining independent and taking care of the things that you need to take care of in order to stay at home. Now, I need to caution you, with longer lifespans and people living longer, my mother just one tiny example, it's possible that people will stay in their homes for a long period of time. However, approximately 70% of people who are age 65 today will spend some time in a nursing home. Sobering, but true. So, if you can stay at home, it's important to understand you may need help in certain areas for certain things. These are some examples. You might need help with homemaking, you might need help with healthcare, injections, medicine, reminders, nutrition, making the food that is healthy, that will keep you strong. You might need some financial support, transportation to get to the senior center or wherever you need to go, and social interaction. So the issue that we talked about it could get lonely at home, and that's something we worry about with seniors. So it's very important to understand the right balance between being at home and having enough activities so you don't get lonely. So there are services to help people who are aging in place, people who are staying at home. I call it, there are 3 different ways this can be done. One is the do-it-yourself way. And what that really means is you find the needed services on your own. You might live in a neighborhood where people are friendly. You might have a group of friends who are all about the same age and condition, and you help each other. So you do it yourself, basically, and you figure out how to get what you need. You get your medicine delivered, maybe, or whatever the things are. The second way is the community approach, and that expands it a little bit beyond just your immediate circle. That can be neighbors helping neighbors with needed services. Sometimes there are community groups, community organizations, and places like a senior center, because you can get help sometimes for certain things through the senior center. An example of something that you can get as help through the senior center is how to figure out what kind of insurance plan to have, what kind of Medicare program to pick. There are people who volunteer who are called SHINE, serving the health insurance needs of everyone. They're counselors, they come here and they can help you. And then the third category, which is one everybody needs to know about, because the first 2 categories can work really well, but the third category you need to know about, because once you start getting into a situation where you have more needs, you need to get professional services to help you through professionally staffed organizations. We're lucky to have here today the PACE, Neighborhood PACE organization, and there's fabulous information here that you can get about PACE, but also you have some information in your folder. And there are excellent brochures and information on this table about topics that may be of concern to you, like if you have children living far away, if you have people who have cognitive decline and need some memory help, that kind of thing. Lots of really good information. I encourage you to stop here. The right care for seniors right at home. And the areas covered, I don't know if all of you live in Revere, but you probably don't. So my neighborhood PACE covers East Boston, Chelsea, Revere, Everett, Winthrop, Malden, Medford, Melrose, Stoneham, and Boston's North End. I can read. How about that? So the materials are right here. Another organization that you can draw upon is called Mystic Valley Elder Services. And how many of you have ever heard of Mystic Valley? Oh, great. Okay, so I don't have to tell you that much. Their mission is supporting the well-being, dignity, and independence of elders, adults living with disabilities, and caregivers. That covers Chelsea, Everett, Malden, Medford, Melrose, North Reading, Reading, Revere, Stoneham, Wakefield, and Winthrop. That's called an Aging Services Access Point, and that means you make one phone call to them, and they help you with everything you might need. And you know about them, so that's great. And the third professional service type of organization that you might need to access is home health care through an agency. And in one of your handouts, which I'll show you later, there is a way to find home health care agencies, and they are rated, so you can get information about a really good one in case you need it. How many of you are caregivers, either for a family member or for, okay. Is it easy or is it hard? Right. Is it a couple of hours a week, or is it 24/7, 365? Right. Okay. So sometimes caregivers like us need support. And there are several resources that I encourage you to seek if you are interested. In Massachusetts, there is a very good comprehensive service called 800 Age Info, and this is for caregiver support. This is to help you get what you might need without doing the very hard work of trying to find it out all on your own. So you call 800 Age Info, and that's the phone number. You can write it down. Then AARP has some very useful planning guides. There is also the Family Caregiver Alliance, which provides a lot of useful, supportive ideas and information. And I cannot emphasize enough the importance of respite services. Respite services are to give a break, give a respite, give a rest to the caregiver. And in order to be a good caregiver, you have to take care of yourself too. So I can't encourage you enough to take advantage of respite services, whether they're from family members, friends, or formal service providers. Nobody can do it 24/7, 365 for very long. So that's a little commercial for helping us caregivers. Okay, going to switch to benefits now. Social Security Essentials. Now, I suspect many of you have already begun taking Social Security, and that's great. For those who maybe haven't or who are not sure what they should do, the starting age is the most important decision you will make about how much your benefits will be. So you can begin at age 62, and your benefits will be a little lower than they would be if you waited until full retirement age. Normal retirement age, where you get the full retirement benefit, is age 66 or 67, depending on what year you were born. I'm old enough that it'll be 66. So, not yet, but really soon. That's normal retirement date. And then if you extend it and wait until age 70, there is an increment. Each year beyond your normal retirement date, you can get an 8% increase in your benefits. So for some people, that is a worthwhile thing to consider. In 2017, this year, the increase that Social Security got, people who received Social Security benefits, got a very, very tiny increase. 1/3 of 1%, tiny. You may not have even hardly noticed it, right. In 2018, starting in January, the increase hasn't been announced yet, but it may be closer to 2%. And while 2% doesn't sound like a lot, it's a lot more than 1/3 of 1%. Anybody can do that math. So it should be announced soon for January. So we'll wait to get that. Now, there's another category of benefits that some people may be eligible for that they may or may not know about. And it's a not particularly well understood area, but I'm going to go over it a little bit here because it's very useful for disabled people. And it's disabled people that may or may not be age 65. So there is something called Social Security Disability Income. Has anybody ever heard of that? Yes, okay. It pays benefits to the Social Security beneficiary or certain family members, and there are some general categories of family members. It pays to members of your family if you are insured, and that means you worked and you contributed to Social Security during the years you worked. That makes you insured under Social Security. The benefit amounts that people can get through SSDI, Social Security Disability, range from $700 a month to $1,700 a month based on a few factors, and those are the numbers for 2017. They may go up a little in 2018. You could apply if you worked long enough to get Social Security. Your medical condition must be severe enough to qualify for benefits, and you, in addition to being eligible for disability income, you will also be eligible for Medicare after 2 years, even if you are not age 65. So disability benefits are available to people who have worked, but who can't work, and who may not be age 65. So, but you would be then getting Medicare. That's one category of disability benefits. The second category is called supplemental security income. Now, supplemental security income is based on financial need and is available only for people who are over 65. There's a test for the amount of assets and income you have, and the assets are very low. You have to have no more than $2,000 in assets or $3,000 for a couple and be on a limited income. But nevertheless, the benefit amount is approximately $735 a month for individuals and $1,103 for couples. That's the amount in 2017. You could apply for supplemental security income even if you didn't work, even if you don't get straight Social Security. But again, the medical condition must be severe enough. And as soon as you become eligible for supplemental security income, you are eligible for Medicare. So these are very important benefits and not quite as well known as some of the others. And and sadly, they must be used by people who are disabled. Okay, that's Social Security. Now, Medicare. The essentials of Medicare. The way I like to think about this is the ABCDs of Medicare. A is hospital insurance, B is medical insurance, C is Medicare Advantage, which is a different kind of plan, but it incorporates Medicare, and D is prescription drugs. The cost of these comes from different places, and the important thing to know about this for people who haven't yet begun Medicare is to understand the pros and cons of the different kinds of programs. There's Medicare, which is called sometimes Original Medicare or Traditional Medicare, and then there's Medicare Advantage, which combines some other things in it. The premiums vary, and the prescription drugs are sometimes included and sometimes not included. So you don't pay for Part A in retirement. You pay for Part B. Premiums come out of your Social Security benefit check, or if you're not getting Social Security, you pay it monthly. The amount that comes out is based on income, and it ranges from $134 to $429 per month. And then Part D, which is drugs, the price varies by those plans from $10 $10 to $100 a month. None of them cost more than $100 a month in 2017. So I encourage you to use the Shine resources that are available right here in the Senior Center, free of charge, to help you make your choice. And it's important to know a couple of other things. That I just said about Medicare, most people who are on Medicare have already made their choice. If you're not, you will. But some Medicare Essentials that people don't know that easily or that familiar, or not that familiar with, are, yes, eligibility is age 65 and disabled. That you probably know, and people know that. The most important thing to understand is what's covered and what's not covered in Medicare. So, one thing that's covered that some people may not know about, and certainly some people may not have taken advantage of, and it may not make me very popular to bring it up, but end-of-life planning discussions with your primary care physician or any other healthcare professional. Those discussions are covered by Medicare. They are 100% covered by Medicare. I cannot encourage you and your family members enough to think about this and to consider having that conversation at the appropriate time. That's covered. Something that is not well understood, that is not covered by Medicare, is long-term care. If somebody has to go into a nursing home for a long period of time, and a long period of time is defined as more than 100 days, when you're really sick or disabled, 100 days is not a long period of time. So only the first 100 days is covered by Medicare. If somebody's in that kind of a condition and needs that kind of a facility, they either have to private pay or get their assets down to very low levels, like $2,000 for a person, and may be eligible for Medicaid. So that's not covered by Medicare. And was there a question? Yes.
Just to go back to the cover at the end of life discussion.
Yeah,
Are
yeah.
you talking like when we would go and meet with the primary and talking about?
At your annual checkup, you can do it.
So you just have, it's just your conversation with the doctor?
That's
about
right.
how you want your.
What things you might want and not want
Okay,
for you or a loved one, for you, when you have, yep.
yeah.
Yep, that's what I'm talking about. Yep. Yes.
And where is the price on that? What do you mean they will cover? What, talking to the doctor?
Right, if
Cover
you,
what?
if you make an appointment to see the doctor for an end-of-life discussion, what does that mean? Okay, I'll tell you what it means. In fact, we're going to get to it in a minute, but you want your doctor, your primary care physician, to understand the kinds of things you might want or not want if you were in very bad condition. An example, a very good example is, let's say somebody has a stroke, and let's say they can't swallow easily, okay? Some people would say, I don't want to be fed by feeding tube. That's an example. You need the primary care physician to know what your wishes are. In the Commonwealth of Massachusetts, there's a form that you can fill out that gives the instructions that what you want and don't want. And we'll talk about that in a minute. Okay? And when I say it's covered, the same as if I go to the doctor because I have a sore throat, my insurance will pay for that.
Yeah. So in the course of that visit, talking about the sore throat,
Right.
100 times I brought this up with my doctor about what's going to happen.
Right.
I can't see why you're saying that they can pay.
It's another code, if you sort of understand how it works. It's the same as if you came in with a broken wrist and a sore throat. They would write down sore throat, code 100, broken wrist, code 200. If you went in for a sore throat and a conversation about end of life, it would be code 100 and code 1000.
And that other one would be another charge. That is ridiculous. ridiculous. I never heard.
Complain to the policymakers.
All right.
Yes.
But isn't that considered like a healthcare proxy?
That's part of
I mean,
it.
you can do
That's
that
part of it.
in the hospital.
Yes, you
private,
can.
Or you can do it with a private attorney.
Yes, you can. Yes, you can. We're going to talk about that. We're going to get to that. We're going to get to that. So I want to get to that at the right time, okay? If that's okay with everyone. Okay. And a quick thing about enrollment, because it's actually rather timely. For people who haven't enrolled, the time period is 3 months before, the month of, and 3 months after you're turning 65. Whether you're collecting Social Security or not, 65. You must do it then, during that period. If you don't do it then, your premiums will be permanently higher. So that's important. And then coming up every year, there's something called open enrollment. And the open enrollment period is a period when you can change plans. And the dates for that are October 15th through December 7th. And that's, if you decided you wanted to change your plan, you would, from 2018, for the plan that would take effect in January, you would have to do it between those dates I just mentioned. Yes,
You're
yes.
saying, is this for Medicare?
Yep.
There are different plans for Medicare?
Medicare offers many different categories, yes.
Supplemental, ma'am.
Supplemental.
The Medicare supplemental.
Okay. Thank you.
Okay, yes, supplemental, sorry,
And
that's,
I'll bring up one thing.
Yes.
Because I do have Medicare now, but you never receive notifications. You don't receive anything in the mail saying, you have to apply now.
Oh.
And then you don't do it, and then you get
it's
the
punished,
higher.
right.
Yeah.
This is a very
You can't
important
fight
point.
it.
The government does not
No.
send notification in
Yeah.
advance of your birthday.
Right.
Private companies send a lot of information for the whole year preceding your birthday and encouraging you to think about it. That's what we mean by the supplemental plans, that Medicare Plus, right, okay?
They send you out a book about the age.
Yes, in fact, I should have, it just came.
Review.
Yep, every
All
year.
in there.
It's all in there. Every year you get a book. And it started, I know. Okay, next, we're gonna move on, so we get finished before the night is over. The night is young, I know. Medicaid Essentials. Now, in Massachusetts, Medicaid is called Mass Health. Is everybody aware of that? Okay. Medicaid covers hospital, doctor, and other medical services, long-term care services at facilities. You do not pay a premium for Medicaid. There's no deductible and there's no out-of-pocket cost for Medicaid. You are eligible based on your assets and income. So that's where it matters. And assets must be depleted down. So all your assets have to be used before you can be eligible for Medicaid. The spouse, if there is a spouse in the family, their assets can be counted separately. But the individual beneficiary's assets have to be spent down. That's the terminology. The resources for Mass Health are listed here. You can call them. Their hours are Monday to Friday, 8 to 5, and their enrollment center is at 45 Spruce Street in Chelsea. Is that far from here? Not bad. Okay. Okay.
Easy to get to without car.
Pardon?
Not easy to get to without car.
Okay. Well, that's where it is. Anyhow, another very important and not as well known benefit available to some Americans are veterans. Veterans Aid and Attendance. It's the name of a program that is for veterans and their survivors who are eligible for a veteran's pension. It's a supplemental program to a veteran's pension. And this is for beneficiaries or people who had been in the military who require the aid, help, and attendance in person of another person. Veterans' aid and attendance takes place in your own home. The benefits are paid in addition to monthly pension benefits. So it is a very wise idea for somebody who is eligible for veterans' benefits to inquire and to get information and potentially take advantage of these benefits. I will give you the amounts in a minute, but I want to give you a sense for what they mean, what is meant by needing the aid and attendance. The conditions, the health conditions that a person must have, whether it's the veteran or the veteran survivor, they require help with activities of daily living, such as bathing, dressing, eating, using the bathroom, in and out of bed, in and out of a chair. If a person is bedridden due to their disability, that would qualify them. If you are a patient in a nursing home, you may still be eligible for this benefit. And for somebody with extremely poor eyesight, that's another condition that could be taken into account for aid and attendance benefits. The way to apply for these are in person at the JFK Federal Building in Boston, Monday to Friday, 8 to 4. It's called the Boston Regional Benefit Office, or online at benefits.va.gov/Boston. So that's a program that not everybody knows about, but should inquire about. This gives you an idea of how much the benefits are, because I really want to encourage people to check this out if they have any connection to a veteran. If a person with no dependents, just an individual veteran, their monthly pension would be $1,075. Their monthly aid and attendance benefit would be $1,794. That's almost twice as much as the pension. If there's a spouse or a child, the monthly pension is $1,409, and the monthly benefit for aid and attendance is $2,127. These are the annual. What's on this slide are the annual numbers. And if there's a surviving spouse who gets a death benefit, it's $721 monthly pension and $1,153 monthly aid and attendance. So if anybody in your world is eligible, I would recommend you pay attention to these benefits. Okay, now we're going to move to legal documents that we were talking about. So we've talked about health care, the different services, the different costs, the different insurance. We've talked about housing, and we mostly focused on aging in place because I get the feeling most of you are interested in that. And there are other options, but certainly that's the one we paid the most attention to. Got to take care of those caregivers. Caregivers have to take care of themselves and take the resources that are available. Then we talked about benefits, mostly government benefits, but now we're going to talk about stuff you need to do to make sure that your affairs are in order so that in case something happens to you, the people around who need to take care of that, take care of you, or so that you will have taken care of yourself in advance, there are a bunch of legal documents that make that process very much better. And I encourage everyone to consider doing these legal documents. A will. This states your wishes for your possessions, your things, your tangible property. That includes residence. That includes any real estate. Each of these documents serves an important and different purpose. Beneficiary forms. This is for any accounts that you might have, like an individual retirement account, or a plan from an employer, or a plan from a government agency that you may have worked for. Gives a beneficiary forms. There's one for each account. This gives instructions for who will get your assets. This is very important because if you have beneficiary forms filled out, then the assets go directly to the beneficiaries for IRA and other retirement accounts without going through a will and without going through probate. So your heirs or whoever are your beneficiaries can get those assets sooner. Healthcare representative. This is what we were calling before a healthcare proxy. This identifies who would make healthcare decisions if you cannot. If you're not in a condition where you can. You had a car accident, you had a stroke, whatever, and you can't make those decisions. A healthcare representative or a healthcare proxy can be named for a short duration of time or on a permanent basis subject to change. A short duration of time might be if you were going into the hospital for something planned and you knew that there were bills that had to be paid or things like that, you can name a healthcare representative who would stand in your place to, not for bills, but for healthcare decisions to be made while you are temporarily unable to do so. Durable power of attorney. This identifies who would handle your financial matters if you no longer can, and that's what I was getting at a minute ago. This is who would sign checks, who would make, if there was a check that was received, who would go to the bank with it, and other financial transactions. Again, a durable power of attorney can be short-term for a specific purpose or long-term if it's desired. A living will states your personal desires for your end-of-life care if you no longer can, and we're going to go over something in this folder in a minute. And then there's the last one, which was what I talked about, which is the important document to discuss with your physician, is the Massachusetts Medical Orders for Life-Sustaining Treatment. This lists the desires for your end-of-life care and even some non-medical issues, but mostly it's medical. Any questions on these? I can't encourage you enough, no matter what age you are, no matter how healthy you are, to ignore these. And I would even say that probably every 5 years, or when some life event occurs, you should review these because life events matter. There are good life events, marriages, new children, babies, grandchildren, all that. There are not such good things. Death, divorce, illness. And 5 years is not really that short. It can be too long. If something happens, 5 years is irrelevant. But if nothing is happening, you should still look at it every 5 years because, first of all, the laws and the rules have changed potentially, and secondly, your situation may have changed. Your health may not be the same. So those are the legal documents, and we'll talk about them a little bit more because I'm going to show you a couple. And then resources, lots of resources. Neighborhood PACE, very important resource you should be aware of. Social Security, Medicare, you know about those probably, and their websites are very, very, very complete, very useful. In fact, you can even, if you're still working, go there, go to the socialsecurity.gov website and set up an account so that you will be able to check how much gets credited every year while you're still working. There's an organization called the Medicare Rights Center, which is a very good organization that if you're having a problem with Medicare, they will help you solve it. and they're very useful. There's the Rossetti-Cowan Senior Center for Shine Representatives. Sorry I mispronounced it, I'm from New York. Home health care, if you want to find an agency, there's a comparison chart through Medicare that's very useful. It uses a star rating, and it gives you an idea of whether the one you think you want is good.
Where is that?
That is on medicare.gov/home health compare. And then the next one is nursing home compare, which is medicare.gov/nursing home compare. If you decide you want the services of an elder lawyer, there's a way to find one through the National Academy of Elder Law Attorneys. There may be some right in town here who you know who are great. I have no idea, but that is an option that you have to find them. There's an association that can help you move. I like to think of them as closet cleaners, but they do more than that. The National Association of Senior Move Managers. Now, this can be a situation where you're still going to be aging in place, but you're going to be moving to a smaller place. So that's another resource. But the last two resources are probably the most important. Not that the others aren't, but these last two are very important. One is called The Conversation. And what this is about is starting the conversations with your family, with your friends, with whoever is important to making sure your senior years and your elder years are what you want them to be to the best of your ability. The Conversation Project was started by a woman named Ellen Goodman, who you may remember from the Boston Globe. For many years, she wrote a column about families and human relations, and the Conversation Project is something I encourage you to look up online, theconversationproject.org, to start conversations about this. In Cambridge, that's correct. And then the last thing on this list of resources, which we will also talk about, is something called 5 Wishes, which some of you may already have looked at. This has to do with what do you want your end-of-life scenario to look like. And it is medical and non-medical, which we'll talk about in a minute. Then the hard stuff, decision-making. You have to make decisions. Now is the time to start. I like to tell people you don't start thinking about college saving in the month of high school graduation. You don't start thinking about what do I want after I get sick 2 days before you're discharged from the hospital. It's not the way to do it. So you got to think about it first. Issues to decide, start thinking about choices and needs. Each choice is unique to the family and the person. There is not one answer for everybody. Do you need help? What kind of help? Who to handle decisions and actions if you can't. So how to make decisions? It's really your choice. How do you make decisions about anything? Each person or family has their way of doing it. Some are more analytic, some are more talkative, some do it quickly, but you got to do it. And you got to start taking the first steps. So, taking action, number 1, start conversations, or I wrote in my notes, start talking. Not a problem for me. Make a plan, and use the handout that we're going to talk about to make a contact list and review the checklist. Remember, it's never too early, but it can be too late. So now I'll take some questions. And well, before we do that, I just want to show you a few things. So in your folder that's in front of you, there's something called Strategic Planning Resources. It's 1 page. I think it's on the left side. It's a front and a back. This lists a lot of the websites and things that I mentioned. And on the back is the action plan and the checklist. I encourage you, if you do nothing else after this, to think about those two things from this document. The other really good one that we talked about is 5 wishes. This comes from an organization called Aging with Dignity, and it is courtesy of Neighborhood PACE that we have these. This takes you through the issues. This is a document that is legally approved in the state of Massachusetts for healthcare providers to follow your instructions. So I encourage you to spend a little time with 5 wishes when you have the time to think about the issues that it brings up. And then we have really nice information about Neighborhood PACE. We have something from a driver who is now a user of Neighborhood PACE, and the medical director, very important person at Neighborhood PACE, and a really special thing. There's an envelope in all of your folders. And I want you to look at the vases in the center of your tables. Well, not that table over there, but this one. The flowers are beautiful, courtesy of Neighborhood PACE.
Those are actually vases that are in those envelopes.
This is what's inside. It's a plastic vase. You open it, and you put water in it, and you can have it. So it's better than glass. It can't break. Okay? The question that was raised is, can we explain the 5-year look back? One of the things that happens for people who are doing financial planning for their elder years is sometimes as people age, they don't want to have the responsibility of taking care of their financial decisions, and they want somebody else to do it, like their children or a trusted family member other than their children, or an outside entity. If people decide to make gifts from their estates in order to no longer have the responsibility for their finances and potentially to qualify for Medicaid, you can transfer assets fully, freely, of your own free will to whoever you choose, and you may get your assets down to the Medicaid eligible level, but you cannot be eligible for Medicaid unless these assets have already been transferred 5 years before. So if somebody gets sick and all of a sudden the family decides, let's move the money so we can be eligible for Medicaid, you can't do that for 5 years. At this point, it is 5. There is discussion about it being increased, but at this point, it's 5. So that means if somebody did it today, it would be 2022 before they were eligible for Medicaid. Steve?
Just a point of information, we have a SHINE counselor here, and if you don't know what SHINE stands for, it's an acronym. It means serving the health insurance needs of everyone. And our SHINE counselor is usually here between 10 and 2:30, 3 o'clock every Monday. And if you do need to see a SHINE counselor here, you call the center here. You really have to call and make an appointment. She gets filled up really fast, particularly with the open enrollment coming, October 15th to December 7th. And last year, it was so congested as far as appointments go. Mystic Valley Elder Services is our aging service provider, okay? They send over a couple of extra people, but it got to the point last year where even if we couldn't handle it, and we sent people to Mystic Valley, they couldn't handle it, and they shut people off. That's how busy they got.
Do it early.
So do it early, don't wait till the end of open enrollment. And like you were saying, Ellen, she covers Medicare, Mass Health, the supplemental plans, and any of the other insurance questions that you might have in regard to your health care.
Absolutely, great. It's a wonderful resource.